Hello, my name is Julie Emerson. I am a student at Excelsior University, and this presentation is Reducing Hospital Readmissions. During this presentation, we will briefly touch on hospital readmissions and some reasons for them, go over some evidence-based solutions to address readmissions, discuss a SWOT analysis and stakeholder impact, and look at transformational leadership strategies to lead the team through change. Florida has traditionally had a robust tourist industry, and because of this, Florida healthcare organizations are accustomed to providing care for the transient patient population alongside the resident population. Over the last few years, Marion County, Florida has been experiencing an unprecedented growth in the resident population. Last year, 2023, Marion County, Florida ranked 9th in positive net domestic migration, according to the U.S. Census Bureau. This influx of permanent residents has made getting primary care appointments or specialist appointments after hospital discharge difficult, especially for patients who have recently moved to the area and are not established. There are varied reasons for readmissions to the hospital. For some patients, the reasons for readmission have to do with social determinants of health, while others find they are no longer able to maintain a normal lifestyle in the community due to chronic disease. For most patients, a hospital stay is ideally followed up by primary care and possibly a specialist provider visit within the first week of discharge. But if follow-up doctor visits are not able to be obtained post-hospital discharge for several months, the patient may not have a choice but to return to the hospital for further treatment. Hospitals across the United States have a goal to keep hospital readmission rates as low as possible because readmissions are very costly for the hospital and the patient. For hospitals, the driving factor to prevent readmissions has been a major fiscal concern since 2013, as Medicare reimbursement rates are directly tied to hospital 30-day readmissions. For the patient, repeat hospital readmissions are not only expensive, but also are a predictor of poor outcomes for the patient. The more times a patient is readmitted to the hospital, the more unlikely it is that the patient will be able to successfully transition back home. Readmissions are bad for patients and families because they produce the combined stress of both declining health and financial burden. While hospital readmissions require an interdisciplinary approach to solve completely, there are some evidence-based strategies that case management can implement that have been shown to reduce hospital admissions. Hospitals with integrated case management models, which focus on patient-centered case management care plans, discharge planning, and follow-up with patients after discharge within 48 hours, have proven to reduce hospital readmissions. To begin with, the case manager should assess the patient early, asking the patient about their social determinants of health to identify barriers to care in the community after discharge. Case managers should also begin timely sharing of electronic clinical referrals to post-discharge community health partners, rather than waiting until the day of discharge. Patients have reported that they want to be updated on their medical condition and participate in their plan of care. The RN case manager should plan a focused discussion with each patient and family prior to discharge to educate on disease process, explore barriers and goals, and encourage management of disease symptoms in the home. This discussion might involve a written care plan or care map for the patient and family that should also be shared with the patient's community healthcare partners and providers. Post-hospital discharge follow-up within 48 hours is another intervention that has been shown to prevent readmissions. The case manager should make follow-up phone calls to discharged patients within 48 hours to ensure that the patient has all necessary medications, treatments, services, or medical equipment that was arranged prior to discharge. In addition, the case manager should find out whether the patient has been able to get in to see the doctor. So you might be asking, how much is all of this going to cost? No additional physical or material resources are required for the evidence-based interventions discussed. However, more time will be spent with patients during patient discussions and care plan mapping, extensive education to the patient and family regarding care goals and the care plan map, and in conduction of home phone calls to patients that have already been discharged. That being said, if the above interventions have the desired results and do reduce hospital admissions, then the time spent performing the interventions will likely be less than the time that is currently spent on repeat hospital readmissions. We will now discuss a brief SWOT analysis for the AdventHealth Ocala case management team. The AdventHealth Ocala case management team has a number of strengths. These are commitment to the organizational vision, mission, and service standards, team unity and cohesion. The team works excellently together and support one another. The case management team is interdisciplinary, with experienced registered nurses, social workers, case management assistants, who all actively make themselves available to share their expertise. We have excellent RN and social worker preceptors on the team, and the team does a good job communicating with one another and with patients. Unfortunately, the AdventHealth Ocala case management team also has some weaknesses. There's high staff turnover, which results in high stress and a constant crisis mode, and creates staff burnout. It also puts the preceptors in continuous training mode and has resulted in a revolving door of agency staff. Another weakness is that staff self-report they don't feel they have adequate time to complete their work because more work is expected in a day than can be reasonably done. Moving on to AdventHealth case management team opportunities, the ideal staffing ratio to be able to spend quality time with patients is 1:16 for RNs and 1:32 for social workers. However, the current staffing ratio is 1:26 for both RNs and social workers on the weekdays and 1:50 or 60 for RNs and social workers on the weekends. Additionally, the case management team is expected to have the same work productivity on the weekends as during the weekdays, so the opportunity would be to increase the staffing model for the weekend to match the weekdays. This would expand the team with the addition of new positions. Another opportunity noted, more for AdventHealth Ocala Hospital as a whole, is for the creation of new patient follow-up appointments post-hospital discharge at the AdventHealth Ocala primary care offices and for nonprofit dollars to pay for visits for the uninsured to prevent boomerang trips back to the ER after hospital discharge. There are several threats that have been identified, which are not enough primary care providers available to serve the community, a patient population with increasingly complex medical and social issues, community resources that are scarce or don't exist, patients and families that either do not accept the doctor's diagnosis and treatments or simply refuse to follow up post-discharge with recommended appointments and care. The stakeholders involved are AdventHealth West Florida Division. The regional CM director is responsible for overall supervision and guidance regarding the recommended changes. The Advent Health Ocala Chief Financial Officer is responsible for approval of all budget and fiscal changes, including staffing changes and position creation. And the Advent Health Ocala Human Resources Department is responsible for staff recruitment. The Advent Health Ocala Case Management Director is responsible for leading staff and implementing the changes. The Advent Health Primary Care Clinic is responsible for seeing recently discharged patients and may require staffing adjustment to meet the need. The patient is ultimately responsible to go to the appointments that have been set up and to follow the recommended treatment plan. At Advent Health Ocala, there are 4 service standards that staff are expected to demonstrate towards both internal and external clients. The service standards are Love Me, Keep Me Safe, Make It Easy, and Own It. By modeling the 4 service standards of Advent Health Ocala, the nurse leader can implement principles of transformational leadership within the framework of the vision and goals of the organization. Love Me. The nurse leader exemplifies the service standard of Love Me by demonstrating the transformational leadership principle of individual consideration. Keep Me Safe. The nurse leader exhibits the service standard of Keep Me Safe by creating an atmosphere of safety for team members to express their ideas and empower them to make positive changes to their practice. Make It Easy. The nurse leader demonstrates the service standard of Make It Easy by supporting the team in providing the necessary staff, equipment, tools, developmental education, and/or skills to do or implement the changes being asked by the organization. Own It. The nurse leader takes responsibility for the direction and performance of the team. This is what is meant by Own It. The nurse leader models the same behavior and speech that is being asked of the team to improve practice. In conclusion, we have looked at the importance of preventing hospital readmissions, ways to reduce readmissions supported by research. We have reviewed a SWOT assessment for the Advent Health Ocala case management team and discussed the stakeholders involved. And lastly, we have touched upon ways that leaders can implement change within the framework of the organizational service standards. Thank you for watching the presentation. I'm looking forward to improving the hospital readmission rates through transformational leadership strategies with the case management team.